Hi Year 12s, so today I'm going to be explaining systematic desensitization. So what is systematic desensitization? It is a form of behaviour therapy. It's based on the principles of classical conditioning. The systematic desensitization technique is proved to be excellent in dealing with different types of phobias. The idea of systematic desensitization is that a phobia, such as a fear of spiders, is usually a learned response. By applying classical conditioning techniques, you can unlearn the response and replace it with a new one, usually of a relaxing nature. For example, Miss Irving is afraid of spiders. She feels anxious whenever she sees a spider. Through systematic desensitization therapy, she can gradually unlearn her anxious response and replace it with a relaxing response. So the steps of systematic desensitization. When applying the systematic desensitization technique to treat a phobia, a therapist often follows the following steps. Relaxation techniques, constructing an anxiety hierarchy or a fear hierarchy, pairing relaxation techniques with the situations described in the anxiety hierarchy. So the first step is relaxation. A common relaxation technique is deep breathing or chest breathing. Here's how to do it. Inhale through your nose, and when you inhale, your stomach should expand. Hold your breath for 3 seconds and then exhale through your mouth. For example, when Miss Irving is afraid of something, for example spiders, the first thing she needs to learn is to relax when she faces the object of her fear. So whenever she sees a spider, the first thing that she needs to do is learn to relax. So how does deep breathing exercise help? When people are exposed to a fearful situation, they often feel shortness of breath. This will intensify the feeling of anxiety, dry throat and muscle tightness. By practicing deep breathing regularly, it is easier for them to become more relaxed even when they're anxious. Another common relaxation exercise used during systematic desensitization therapy is progressive muscle relaxation. In this exercise, people are asked to tighten their muscles and then loosen them gradually. This will result in deep muscle relaxation. In psychology, VCE specifically, we tend to focus on deep breathing when looking at systematic desensitization or graduated exposure. The construction of the fear hierarchy or the anxiety hierarchy is the second step. So in this step of systematic desensitization therapy, people are asked to list 10 to 15 triggers of a specific phobia or situation and rate each trigger from 0 to 10, where 0 represents no anxiety at all and 10 represents extreme anxiety. In some cases it goes up to 100, it really depends on which one you are following. Most common is up to 100. For example, if Miss Irving is afraid of spiders, her anxiety hierarchy might look like this. So at the very top, at the very lowest anxiety would be entering a clean and bright room with no spiders. Right? Then it would go to thinking about a spider, seeing a photo of a spider, seeing a spider at the far corner of the room, standing near a sofa where there is a spider. Right, all the way down to seeing a spider crawling on your hand. In the next step of systematic desensitization therapy, people are asked to imagine themselves being exposed to their object of fear. So this is the third step. For Miss Irving, who is afraid of spiders, she is advised to close her eyes and imagine herself in a room alone with a huge spider. So this is the first section. When she feels anxious, she is asked to practice the deep breathing relaxation exercise, such as deep breathing or deep muscle relaxation. After imaginal exposure, the person is asked to rate her fear of spiders. So when Miss Irving's rating for the fear of spiders drops to a specific value, the therapist moves on to the next step of Miss Irving's anxiety hierarchy. For example, Miss Irving is asked to look at image of spiders and then be in the same room as spiders, but you don't move on to the next step until Miss Irving has actually completely relaxed around that particular stimuli step. Miss Irving is then advised to practice deep breathing and other relaxation exercises whenever she is exposed to spiders so that her anxiety will gradually be replaced with relaxation. The systematic desensitization therapy continues until Miss Irving feels no fear when she is exposed to real spiders. Although systematic desensitization can be self-administered, it is more effective when working with a behavioural therapist or a psychologist. Now, please go study. If you have any questions, don't hesitate to ask.